This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Michelle AQ50 injection is used to support early pregnancy and address hormonal imbalances. It is administered under medical supervision to ensure safety and effectiveness. Indications and uses. This injection is indicated for the maintenance of early pregnancy in individuals with a history of repeated miscarriages due to luteal phase defects. It also serves as an adjuvant to infertility techniques like IVF and GIFT, facilitating successful implantation of fertilized eggs. Additionally, it is used to manage threatened abortions and abnormal uterine bleeding stemming from hormonal imbalances. In a diagnostic capacity, it aids in determining the endocrinal causes of secondary amenorrhea among infertile women. How it works. The medication functions as a steroid hormone that supplements the body with necessary levels of progesterone, crucial for a successful pregnancy and the maintenance of uterine health. Directions for use. Administration of this injection is strictly conducted by healthcare professionals, either intramuscularly or subcutaneously. The prescribing doctor will determine the appropriate dosage and duration based on individual factors such as age, body weight, and specific health conditions. Possible side effects. Possible side effects include pain, redness, or swelling at the injection site, headache, nausea, and changes in mood. If any side effects become bothersome, consulting a healthcare provider is recommended. Precautions and warnings. Before receiving this injection, it is essential to inform the healthcare provider about any existing medical conditions such as liver, kidney, or heart problems, as well as any history of blood clots or cancers. This medication is contraindicated in certain populations, including those with ectopic pregnancies and breast cancer. FAQs. 1. Does this injection cause weight gain? Yes, it may cause weight gain due to overstimulation of the ovaries. 2. Can it make you feel tired? Yes, some individuals may experience tiredness. 3. How is it administered? It is given by a healthcare professional via intramuscular injection. 4. Who should avoid it? It is not recommended for those with a history of ectopic pregnancy or certain cancers. Thank you for watching. If you have any questions or suggestions, please leave a comment below. We appreciate your feedback and hope to see you in our next video.